Welcome everyone. This is Dr. Jaitly, your cardiologist on your favorite video site, MuniMeterHealth, which is being shown on several social platforms, and we have a collection of now close to 300 videos, Cardio 360s, which are now being shown primarily to enhance medical education, number one, and number two, increase the patient education so that we can increase the clinical outcomes and enhance the clinical outcomes rather in our patients. So thank you again for associating with MuniMeterHealth. Bring one, bring all. And of course, without any further ado, I like to delve into a very short subject here on this video vignette, which I always do. And today we're going to be talking about the legalization of marijuana use and how does it impact on the cardiovascular conditions. And chiefly, of course, we know that that's in the process right now, that increasingly now more Americans, when you do a Gallup poll or other polls, are interested in seeing marijuana being now being legalized or decriminalized, if you will. We know cannabis, which is the plant, the Cannabis Sativa plant, which has been used for centuries, I believe, worldwide, has contributed a great deal of recreational use and thereby recreational abuse as well, or drug abuse, either by smoking or inhalation or by topical or oral use. But nevertheless, the compound there has been tetra-hydro-cannabinol, THC as we call it, and that is the one which is the one that's the botanical compound that's out of these plants, the Cannabis Sativa plants. But FDA has not, I just want to say that FDA has yet to approve any indication yet, but there are proposed conditions where it can find some use, and that's where the current debate is. People have worried about whether cancer pain can get better. People have worried about whether or not neuropathic pain. There have been some data where the neuropathic pain, specifically so in the HIV-related or HIV-related nausea and vomiting, especially when patients with AIDS, they receive multiple chemotherapeutic agents, or cancer patients as well, when they receive chemotherapy agents, they seem to be benefiting with the compounds that's present in some of the FDA approved medications which are currently in the market, called Marinol and Syndrose and Sesamet. Again, they contain these are man-made cannabinoid compounds, but it's not anything close to the THC which is present botanically, which is not FDA approved. So just make a note of that, please. Now, the other thing is, now what are the cardiovascular effects? Because that's where we are talking about. So the heart rate increases, the blood pressure increases, both systolic as well as diastolic. Just remember that. And then the sympathetic tone increases, which will again impact on the vessels, obviously, and therefore the peripheral vascular resistance also increases. So you have effects on the heart. You have effect on the blood vessels across the board. So from the heart, of course, you can see tachycardia and hypertension developing. So one could see that. And from the blood vessels, obviously the hypertension again, but at the same time, the peripheral vascular resistance is extremely increased also. Now, needless to say, if somebody is already having a pre-existing angina, for instance, or pre-existing cardiac arrhythmias, pre-existing somebody has had a history of MI in the past, these are the conditions where obviously all of these effects, the cardiovascular effects that I just pointed out, will be absolutely detrimental. So one of the things that will show us in future is obviously all of these patients will have to be screened very, very thoroughly for cardiovascular, should FDA approve the indications in 2018, 2019, who knows when. But the fact is that whenever that happens, obviously, there will be a burst of such patients who will require, say, cancer pain relief or neuropathic pain relief, or even epilepsy, seizures relief, etc. That has been shown. Some anecdotal reports are there, as well as the chemotherapy-related vomiting, like it's an anti-vomiting drug that has some effects that have been shown. So no sooner the FDA approves these indications, the chances are that we'll have to immediately start screening patients for cardiovascular purposes, because obviously many of these patients can belong to that category of age where angina, arrhythmias, and myocardial infarctions could be prevalent, or they are prone for any of these conditions. So cardiovascularly wise, I think one has to be very, very prudent before you can actually prescribe any of these indications. And of course, right now, as I said, it's not approved, and I underline it here, but at the same time, I think this is just an educational video, so that we are, we are at the cusp of almost getting into 2018 now, and this is December 2017. I just want to be sure that we understand that it is a hot debate in the country as well as in the world, and where again marijuana, which has been for centuries been known as pot, weeds, or grass, any of those street terms, but the fact is that now the legalization or decriminalization will actually that has been proposed, and certain indications that will fall into these other categories where it could be potentially be used, but awaiting FDA approval first. Okay, so this is where we are with the current cardiovascular effects, obviously, and of course these are the indications where you have to be very, 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 very careful, where it'll potentially require to screen these patients before anybody can indicate this marijuana use. Okay, so again, the compound is tetra-hydro-cannabinol. It's a long name, but just remember it's THC, and that's basically it in a short. And then you'll hear more about this in the coming year. All right, thank you again for your attention, and stay well and stay with MuniMeterHealth, and looking forward to seeing you again on my next